Welcome to Season 2 of Talk Me Healthy. Each month, we invite a guest to explore a topic related to healthy living. They share their expertise, personal stories, and we learn from them how they turned their passion and knowledge into practical tips that you can use now to improve your health. I'm your host, Scherrie Keating, founder of Diabetes Care Consulting. My goal is that you will hear something each show that will motivate you to make a small change towards living a healthier, happier life. Hello and welcome to Talk Me Healthy. My name is Scherrie Keating and I'm your host. Today's show is going to save lives. I'm so excited. We're actually going to talk about the American Heart Association's hands-only CPR and how to use an automatic external defibrillator. And I brought a very special guest today, my friend Cheryl Shaw, who actually, she's going to kill me for saying this, but she actually was my preceptor when I was a nursing student 35 years ago, right, Cheryl?
That's right.
And Cheryl is a registered nurse. Cheryl is an American Heart Association instructor. She is a training officer for DMAT, MA2, and she is the owner of her own company, Shaw Healthcare Education. So Cheryl, welcome. I'm so happy.
Thanks
Thank you
for
so much.
having me.
Oh, I'm so
This
excited.
is exciting.
Cheryl and I work together weekly, pretty much teaching CPR courses, and
Yes.
so I'm excited to have you on the show. And I know your expertise, and the viewers are going to learn a lot from you today.
Great.
So thank you. So tell the viewers. I know plenty about you, but tell the viewers about you and why you're so passionate about doing what you do.
So I've been a registered nurse for over 40 years. Most of my career has been in the emergency department, which I love. I love helping people. And about 18 years ago, my manager got me involved in DMAT, which is a Disaster Medical Assistance Team. It's a federal medical team, and we respond to disasters and provide medical care when the hospitals have been devastated, which is probably the most rewarding part of my job. We see people at their worst and see the best come out in people. And it's challenging, but it's extremely rewarding. And then about 6 or 7 years ago, I decided to start my own company. I had been an educator in the emergency department. I still work in an emergency department. And I thought, I really enjoy doing this. So I teach CPR, first aid, advanced life support, and pediatric life support. I also work with a group of fire departments and do some of their training with them as well. And I enjoy all the parts of my jobs, I also am a lifeguard and swim instructor at my local town beach during the summer. So it's always either something helping people or teaching people, and that's just what I love to do.
And you are so good at it. And I
Thank
learn
you.
from you every single time I work with you. It's amazing. So today I really wanted the viewers to know how easy it is to save somebody's life. And as I was researching some of the statistics on the American Heart Association, unbelievable how CPR, doing hands-only CPR, can really make a huge difference. And it is not that complicated. Anybody can learn that.
Anybody can learn it. And the American Heart Association has a brief video. It's a little comedy routine, and it's about hands-only CPR. If you go to www.heart.org, there's a lot of information for the public on hands-only CPR, also about taking CPR classes and more information about it. Many people are afraid to do CPR because they don't want to do the breaths. They're afraid, they don't know the person, or the person has blood around them, or they vomited, and they're afraid to do it, and they're afraid they're going to do it wrong. But American Heart is promoting for the public the hands-only CPR because immediate CPR can double or triple the chances of someone's survival. So you can help save a life until the advanced people arrive.
So when would you use CPR?
So you would use CPR, someone is unresponsive, not breathing. You wouldn't know as a layperson whether they have a pulse or not, but if you shook them and nothing happened, the chances is that they are not breathing and they have no pulse. So you would want to start CPR right away. The first thing you would do is call 911 because you need those people coming. And one of the things that will happen is when you call 911 from a cell phone, you get connected to the state police. Whether the GPS is on your phone or not, it's going to connect you to the state police, and you tell them what town you're in, and they will connect you to that dispatch. The next thing that people don't think about is once you call 911, they're not going to let you just hang up. They're going to want you to stay on the phone because they want to know if there have been any changes, your exact location. So learn how to put your phone on speakerphone when you are making a phone call. Every phone has a little icon that shows a speaker. You put it on speakerphone, you put the phone down, and you can do your compressions.
Okay, and we're actually going to demonstrate that in a little while.
We are.
So we're not going to talk about the procedure of doing that right now, but we're just going to talk about why we should do that. So tell me, why should we be doing CPR?
So that we can save our family members, our friends. You can help out a stranger if you wanted to. But chances are you have a family member or a friend that may experience some sort of cardiac event in their lifetime, and you want to be able to help. You won't feel so helpless.
And the statistics.
There are 17 million deaths annually in the world from cardiac disease. It is the leading cause of death in the world, more than all cancers combined. So it's huge. And if you can prevent one death, then you are helping someone.
And it's so much easier than people think.
Yes, it is. It is not hard to do.
And like you said, it doubles and triples their chances of actually surviving.
Correct.
By doing hands-only CPR.
Correct.
And why do they not have to give the breaths? Because a lot of people think of CPR as doing compressions and giving breaths. So why do you not have to give breaths as doing hands-only CPR?
If you're doing hands-only CPR, you're still circulating blood and what oxygen is left in their body. So that's going to keep your brain and your heart and lungs going until EMS arrives.
Okay. And an automatic external defibrillator or an AED, what is that purpose?
That purpose is to stop. Sometimes when a person's heart stops, it hasn't fully stopped and it's just shaking. The AED can detect that rhythm, and that rhythm will respond to an electrical stimulation. What happens is it actually stops the heart and hopes that the heart will take over its normal beating again. The reason we talk about AED so much is they are prevalent everywhere now. Many schools have them. They're prevalent. If you walk into a large airport like Logan, if you just look down the hall, you will see about every 100 yards there's an AED. Most sporting arenas have them. Many churches and large organizations have them. And they were made so that the layperson could use it without having been trained on it. It walks you through every single step of it. All you have to do is turn it on. And then it tells you every single piece of what to do.
And sometimes you just have to lift the cover and it will turn on automatically. You don't even need to press a button.
Correct.
You can just lift the cover and listen to the prompts.
Correct. There are many, many types of AEDs out there, but they're always the same steps. It's turn it on, and if it's one that you lift the handle, it says right on it, lift handle to turn on. So you just turn it on and listen to what they tell you to do.
So people are afraid to do CPR because they're afraid of the legal ramifications of doing CPR. So is there anything that protects somebody from that, from being held legally responsible if, say, a rib cracked, or because sometimes one of the problems with doing CPR is you may crack a rib. but you're
Correct.
saving somebody's life. So they may
Correct.
have a cracked rib, but you're saving their life.
Right. They can heal from the cracked rib.
Exactly.
So there is in place in all 50 states and the District of Columbia, there is in place a Good Samaritan law. And each state differs slightly. But what that was done was so that people would be more likely to help someone that they thought was in trouble. So what it does is provides legal protection for someone that is rendering aid to someone that you feel is injured or ill or incapacitated. So it protects you. If you did CPR and you saved that person and then they came back and said, but you broke my rib, you're protected.
Okay, that's good to people to know. So hopefully they are not going to be afraid to do this because it will save lives. So is a cardiac arrest the same thing as a heart attack?
No, it is not. A lot of people think that. So cardiac arrest is when the person has actually stopped breathing and their heart is no longer beating. A heart attack is when something has happened in the heart, like a small blood clot, and it causes damage to the heart. It doesn't necessarily make the heart stop. Yes, that could be the cause of a cardiac arrest, but they're very different scenarios.
Okay. So you know what? I think we can actually show and demonstrate how easy it is to do hands-only CPR and to use an AED. So if you viewers are ready, we're going to do that right now.
Oh my God, there's somebody laying in the street. They're not moving? Okay, I need to call 911. Hi, I need an ambulance at 27 Main Street in Sterling. There's someone laying in the street. I'm going to put it on speakerphone and I'm going to do what American Heart says. I'm going to push hard and fast in the center of the chest at 100 to 120 times a minute. And I'm going to keep going until help comes. Here comes the ambulance. They're going to take over. And I've done my part to help save a life. I'm in the airport. There's a person down on the ground. Hey, somebody call 911. Can you get me an AED? I'm going to push hard and fast in the center of the chest. I don't really know CPR, but I've watched the hands-only video. Scherrie has brought me an AED. They are everywhere now, and you don't have to be professionally trained to use them. What would happen is Scherrie would keep doing compressions for me, and I would set up the AED. Very simple. Made so that people who have never used one before can do it. You turn it on, and you do what it says. She tells me to put the pads on the patient's bare chest. There's a picture of where the pads go. I work around this person. Don't touch the patient. And we would keep going like this and listen to the prompts from the machine. It will tell us every 2 minutes to stop, and it's going to see if the patient needs a shock. There are AEDs in many schools, sporting arenas, churches. Many, many places have them, and they were made so that people who don't know CPR can help. And all you have to do is get it, turn it on, and listen to what the machine tells you to do. It's very simple. It helps take all of the stress out, and you can help save a life.
So it really is that easy. CPR saves lives, and so can you. So we are going to put the link to the American Heart Association on the show. And you can see the show on Sterling-Lancaster Community TV. You can see it on Diabetes Care with a K Consulting.com or on Diabetes Care with a K Consulting on YouTube. And so we've talked about saving lives, but how can we prevent somebody from having a heart attack or a cardiac arrest? What are some of the risk factors that people can do today to prevent even getting to that situation?
So some of the risk factors are we've become a very sedentary society. Mm-hmm. So we don't routinely exercise. People are playing video games and sitting in offices. So some of the things that people can do to keep themselves heart healthy are healthy diet. Mm-hmm. So fruits and vegetables and lean meats and fish and chicken. Mm-hmm. Plenty of water. You should drink half your body weight in ounces of water daily. Mm-hmm. And plenty of sleep, which I can tell you that most of us do not get enough sleep, myself included, and regular exercise. And people think, oh, exercise, I have to go to the gym. You don't have to go to a gym. You can start off with watching TV, march in place during the commercials, and add to that every day. And you'd be surprised how much you can improve upon that every week. Even if you did it one time a week, stand up and march in front of your chair during a commercial. You don't need any fancy equipment. You can march in place for 30 minutes up to that every day in front of your television. And you still get to watch your TV show. Mm-hmm. Other things that people can do is if they have known risk factors such as high blood pressure, high cholesterol, they've got a family history of heart disease, is really listening to their primary care physicians if they're prescribed medications to take them routinely. I have many patients that don't routinely take their blood pressure medications mm-hmm. because, oh, my blood pressure was good last time. Well, you need to help control that. So watching your weight, taking your medications, getting routine physicals, and leading a healthy lifestyle the best you can. Not everybody is able to get out and do everything that they should do, but doing the best you can to lead a healthy lifestyle.
That's excellent advice, Cheryl. And so to sum it all up, we need to lower our risk factors. Mm-hmm. We need to live a healthy lifestyle. We want to eat healthy. We want to get some exercise. We want to watch our stress levels. We want to keep our weight as close to normal as possible. We want to get enough sleep, get enough water. We want to perform hands-only CPR if someone's in a cardiac arrest, which the symptoms would be.
So symptoms for cardiac arrest is going to be someone is unresponsive and you can't arouse them by shaking them and saying, hey, are you okay?
Okay, and they're going to call 911, stay on the phone, keep their phone on speaker, know their location.
Correct.
Very important if they want help to arrive. To push hard and fast, 100 to 120 beats per minute. And there's a song that they teach us.
There is a song. It depends how old you are, whether yes. you know the song or not. But it's from Saturday Night Fever, and it's the Bee Gees' Staying Alive. If you sing that song in your head, that is the correct beat to do your compressions to. So that's
you want to sing that for us, Cheryl?
No, that's okay.
So staying alive, but just hard and fast.
In the center of the chest.
In the center of the chest. And continue to do that until 911 comes to take over for you.
Correct.
Okay. Now, what if you get tired? Because doing CPR is exhausting.
It is exhausting. You would do the best that you can.
Okay.
Until help arrives.
Okay.
Because every time you stop doing compressions, you lower somebody's chance of survival.
Okay. And doing CPR increases their survival by
2 to 3 times.
Exactly.
So immediate CPR is what can help, and that can double or triple their chances of survival by doing immediate CPR. And that is why American Heart still promotes hands-only CPR so that people will get involved.
Awesome. And then knowing where your AEDs are, your automatic external defibrillators.
Correct. If you're in a large area, look around to see if you see the AED. And you'd be surprised at the places you'll find them.
Casinos.
Casinos have them all over the place.
Yeah.
Many times they're labeled. You can look down a hallway and see a little sign that says AED mm-hmm. sticking out so that it's very visible to you. Mm-hmm. So you'd be surprised at all the places you can find AEDs.
Too, right?
Many schools have
mm-hmm.
them now as well.
And that will save somebody's life too.
Yes.
So it really is, CPR saves lives, and all of us can save somebody's life.
That's right.
So Cheryl, I can't thank you enough. Incredible information, and I know this show is going to save somebody's life.
I hope so.
I know it will. And thank you so much for all your expertise and all that you're doing to make a difference in the lives of others.
Thanks for having me.
Oh, you're very welcome. So remember, next month we will be having a show. I will be having a Dr. Mark Addy, who's a hospitalist in the area, and she is actually starting a health clinic in Ghana. And we are going to learn all about her health clinic, which will be exciting, and see pictures. And so remember to live your best life every day starting today. This is Scherrie Keating. Talk Me Healthy. Thank you.